It says meeting is now streaming live.
All right. Excellent. Then I'm going to start recording.
Still waiting for it to show up on YouTube. Hasn't gotten there yet.
I think there's a delay.
There it goes. Just showed up.
All right. Good, good. All right. So we'll call to order the Board of Education meeting of August 11th, 2021. This is a meeting that is being recorded and fully virtual with access by phone or by streaming as indicated on the agenda. I'm going to ask that all participants mute themselves to prevent the meeting from having interference, and that people on the phone can unmute by using *6. I don't see any phone users yet, but we may have some. I also ask that everyone wait to be recognized by the chair before speaking so that people listening by phone are able to identify the person talking. And then we will start with the Pledge of Allegiance. If I share my screen. All right. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, and I think the next item is our public participation. So I don't believe we have anybody additional.
Should we do the commitment to the community first?
Oh, yes. Since you've noticed.
I opened up my mouth, I should say.
Can you read it for us?
As citizens of our community, we will conduct ourselves in accordance with Newtown's core character attributes as displayed in our character tree. We will be responsible for our actions and show respect for each other. We will interact peacefully, productively, and politely. We will be trustworthy and honest and show compassion toward others. Newtown's continued success is contingent upon our ability to persevere, to follow through with our commitments, and to stay focused on the greater good.
All right, thank you. All right, so I am not seeing any public participation. So we did receive quite a bit of email, and so that might explain that. And I appreciate everybody weighing in before the meeting. So I will open public participation, and not seeing any public participants, I will close public participation. And that will bring us to our third item, which are our reports. We didn't have a full report based, we don't have the subcommittee reports, but the chair report, I just wanted to just talk about the Department of Public Health meeting that was held yesterday. But I do want to welcome everybody to our third special meeting of the summer. We've had quite a few to address some topics that have come up over the summer. That's unusual for us to do that. But this meeting was really needed to provide clarity, because since last spring, the state gave signals that the mask mandate in schools might be removed. However, that has not happened. And the mask mandate that was put in place by the executive order by the governor, and that was 12A, and the reference Department of Public Health rule, that has remained in place. And executive order number 13 extended that mandate through September 30th. So At this point, we need to address that because our plan that we talked about, when was it, last June, will not be consistent with those executive orders and some changes that have happened since then. So I want to thank Dan Cruson for responding to those many emails that we have been getting in, and just let people know that we have been reading them. And so just in terms of the Department of Public Health, State Department of Education meeting that happens weekly, that happened yesterday, and I just thought it was worth mentioning a few things that came out of that meeting. So they did reiterate that Executive Order 12A and the Department of Public Health rule is still in effect until the governor, and unless the governor makes a change. And they also reiterated that the current increasing rates in Connecticut in COVID are a change since our last spring when we left school in June. They shared the same mitigation strategies that have been in effect since last year. Those will continue that they're recommending with some modifications. And so I just thought the one that was really worth noting, most of them are very similar to what, or the same as what we had last year. There was one that was worth noting, and that is that they have recommended that students seated 3 feet or more from another student diagnosed with COVID-19 do not need to quarantine as long as they remain asymptomatic and masks were in use in the classroom. This exception to the contact definition applies to exposures between students only and in the classroom. So I think that is a change that will help reduce quarantines, but it's also dependent on students being masked in the classrooms. So I thought that was worth noting. And that is really the extent of any changes that came up. So I'll conclude there, and I see Dan Cruson, you have a question or a comment?
Someone just reached out via email saying people are trying to call in and the PIN isn't working. It's saying the meeting ID doesn't exist.
Oh dear. Let's see, the meeting ID is exactly what we are using to be on the meeting right now. So that they're saying the meeting ID doesn't work.
Yes, we've gotten one email that says they've been trying, as well as many others, says meeting ID does not exist. I haven't actually tried it myself quite yet, so I don't know if it's that simple or what's going on.
Well, do you want to take a 2-minute break to see if we can figure out, so that we can let people know? I mean, at the very least, they can see on YouTube what's going on.
Yeah, I think it's this person, at least the person that emailed us, is interested in stating.
I'm trying right now.
They
It says
stated,
it does not exist. It says the PIN does not exist for the one that's listed on the agenda. I just did it. So I don't know if there's a.
Is that the correct PIN, Michelle, that was on the agenda?
Yeah, there might be a transposition error or something.
Now, if I may, we're on a Zoom meeting, but the phone was answered with "Welcome to Google Meet."
Oh,
So, you know, we're not on a Google Meet meeting. So I don't know. I would be surprised if the two crossed over.
so it seems like we have to get the information, and B, I guess, share a screen and post on the screen what the correct connection details are.
That's the phone number that I dialed says welcome to Zoom.
Okay, so I'm trying to compare. I've got too much open. I have to find the agenda.
It says for public to listen to the meeting. Is there a different one for the?
No,
public?
I'm wondering if it's, I'm trying to find the agenda so I can compare the meeting number with the one in the link that we
Yeah.
got.
I have the agenda. Are you looking for the call number or the PIN number, Dan?
87068.
It's the 87006.
There is an extra 0 in the one that is on the agenda. So it's right, but so it should be 870-0685-8844.
Ah,
I think if you take that last 0 out of there, it'll work. Although, Dan, can you test it for me?
I've got,
Or, if someone pops up on the screen after hearing me say that, then we'll know.
Wait, take the last 0 out of where?
So out of the pin on the agenda has one more digit and it has one more 0 than it should. So the 0 that comes right before the 8844 should be dropped. And I think that.
I apologize. That's my fault. I stuck a 0 in there and copying it. I'm very sorry.
That's all right. We'll get it. We'll manage it so that,
I was gonna say, that's okay. That's
I
the
should
problem.
be coming into the meeting now, Michelle.
That's the exact problem I fear every time I do a meeting. Oh, I see a phone number.
Yeah, I'm in.
okay,
I'm gonna hang
And I
up.
see another, and here they come.
good, good. No, I hit
I
the
think-
top of the list instead of the bottom of the list. So,
And Michelle, I might have accidentally muted you, sorry.
all right. So shall I share the number on my screen just to? So it's
Just
8.
Just to cover our bases, people obviously have gotten the message, but it's 870-0685-8844.
four.
All right, let me see if I can make that into a slide and then,
Or just a notepad or Word or whatever you can get. Actually, do you want me to do it? It looks like I have share capability.
you already have it. I'm making,
Yeah, Deb Peterson I will send,
all right, I'm gonna,
Got to get rid of the O.
You've got one too many zeros. There you go. That's the one.
There you go.
What happened?
8844.
all right, so we'll give it, I don't know, let's give it a few minutes for people to call in if they, and then we'll take public participation.
Yeah, there's an extra 0. All right.
And Michelle, I'm sorry if I think I keep accidentally muting you because as I admit people, my screen isn't refreshing very fast.
That's okay.
I
Hopefully,
lost my superintendent's report.
all right,
Hold on, Michelle. What did I do?
I'm trying to think if there's any way to keep that screen up, but there isn't really as we continue the meeting, is there?
Other than sharing your screen the whole time, no. Or I could share my screen instead, but in either case, we'd have to keep this portion of it up.
Yeah. All right. Well, I mean, public participation will only last so long. So maybe what we should do is go ahead and the public participants won't be able to, they're not on screen anyway. So
Is there a way to get that out first and give them a few minutes?
get what out first?
The new number?
Well, they should be able to see the shared screen right now, and they have been since she put it up. So
Okay.
I think if we just leave it up, if Michelle's okay with leaving it up through public participation, once we close public participation, we don't really need it anymore because we only have the one public participation today.
Yeah.
Okay.
All right. So why don't we, do you want to wait and do your report until after public participation, Lori?
Sure.
And we'll pause and take public participation now. So I will open it up, and you need to use *6 in order to unmute yourself on the phone. And if you would limit your comments to 3 minutes or less, we would appreciate it. And share your name and address for the record. And we, for our public participation at this meeting, it is limited to the items on the agenda only. So I will open it up now. Is there anybody who'd like to speak? So we have
I'll
lots.
speak.
There we go. Hi.
Hello?
Oh,
Is
hi.
it- Hi. Hi, my name is Anne Marie.
Can you share your last name and address with us?
I can. It's Anne Marie Gianni,
Mhm.
and it's 64 Pondbrook Road in Newtown.
Thank you. And go ahead.
Okay, thank you. Though my kids do not go to public school here, my daughter is enrolled in a private school in Newtown, and I'm here to hopefully help keep the parental choice for masks. Danbury Hospital has only 15 or so cases of COVID right now. This is a much different conversation than it was last year. Our state has done an amazing job, and you all have done an amazing job. Thank you. I received my college degree in sports medicine. I actually worked at New Fairfield High School as an athletic trainer in my 20s. When I was in school, one of my professors warned us not to wear masks for a prolonged period of time, as they are restrictive, instructing us to listen to our bodies and to take breaks as need be. I am highly concerned if your plan to mandate masks, again, if this goes back into place amongst these young kids, they do not have the understanding to listen to their bodies and to take breaks as need be, as we do as adults. Also, our kids are not at risk or in any danger. You have heard many times, according to the CDC, that the COVID survival rate of children is 99.997%. Children are at greater risk of death from the flu than they are from COVID. They have proven to be resilient to this virus and are safe. Dr. Marty Macary's research team at Johns Hopkins found a mortality rate of 0 among children with no pre-existing medical conditions. And in an article just put out by the Wall Street Journal, states, do masks reduce COVID transmission in children? Believe it or not, they could only find a single study on the question, and the results were inconclusive. There were not many studies done. There weren't any studies done, basically. Masks are actually more harmful than good, also stated in this article. By increasing airway restrictions during exhalation, masks can lead to increased levels of carbon dioxide in the blood. Just like my professor warned me years ago, a mask can be vectors for pathogens. They can also become moist, and they can be, and bacteria can grow in them. And in March, Ireland's Department of Health announced that it won't require masks in schools because they may exhibit anxiety or breathing difficulties for some students. As you know, the FDA website defines face mask and PCR testing as emergency use authorizations, meaning unproven and experimental. With anything experimental, there should be informed consent. And as a parent of a minor child and I am legally authorized to refuse consent. I beg you please to keep your decision from June and to let the parents be the ones to decide what's best for their children. We have this under control. You all have done such amazing jobs. So now let our kids be kids. Thank you.
All right, thank you. We appreciate your sharing your comments with us.
Yes, thank you for the time.
Hi, yes, can I speak?
Yes.
Hi, yes. My name is Jennifer Malta. I reside at 3 Berry Drive, and I also agree with Anne Marie's statement. I have concerns about mandating masks also. I believe it should be the parent's choice to decide if their child should wear a mask. I'm not comfortable with my child being forced to cover his source of oxygen. Masking restricts oxygen and poses even more health dangers to our children. There was a study conducted where out of 45 children, 100% reached at least 4 times the OSHA permissible limitation of CO2 exposure in under 10 minutes. That came from the Journal of American Medical Association, dated in June of this year. Masks do trap bacteria and moisture, making children susceptible to infections. Did you know that a root cause of cancer is oxygen deficiency, and masks restrict oxygen? If you deprive a cell of oxygen, it may become cancerous. That comes from 1931 Nobel Peace Prize winner, Dr. Otto Warburg. Will the school system assume liability if a month from now, a couple years from now, it's determined that my son got cancer from wearing a mask to school? Is the school really want to take on that liability? I respectfully request that you consider this when making your decision. Thank you so much in advance for your support.
Hi, can you hear me?
Michelle, you're muted.
Hello.
Michelle, you're muted.
Thank you, Dan. Yes, we can hear you. Go ahead.
This is Liza Llewellyn. Can you hear me?
Yes, we can hear you, Liza.
Okay. Sorry. So 10 Wills Road, Newtown. I was at some of the previous meetings when you first did your back to school plan in regards to giving our children choices, well, parents choices for masks. And I will say that my position has changed drastically over the last couple months as I've seen the numbers increase in my hospital and in speaking with peers throughout the country and seeing the pediatric rates of infection and critical levels of care that is needed. I 100%, as a respiratory therapist and the director of respiratory services of the local hospital, support your decision if you were to change to mandating masks. If 500 children wore masks and it saved one kid from ending up on a vent or dying, I think the choice is pretty obvious. That's all I have to say. Thank you.
Thank you for sharing your new thinking on this. All right, is there anybody else who'd like to?
Yes, can you hear me?
Yes.
I'm
Hi.
Julie Retzoff. I live at 194 Woodville Road. Thank you for sharing. I was also at the last meeting, and I guess my question for that would be, if there were data proving the safety of mask wearing and the proven that the masks actually do help in avoiding risk and viruses, how come that data hasn't been provided to parents that are concerned about all the studies that have been given showing that masks, reduce the intake of oxygen and germs are trapped near your mouth and nose, increasing risk of infection. And wearing a mask causes you to touch your face more frequently. There is no scientific evidence that supports healthy people wearing masks, especially children. that the CDC themselves have said 0% risk, and that's a nationwide study. I also think it's really unclear with all the narrative going on in our news and otherwise exactly what is happening. So I don't think it's fair to ask parents and children that do not want to wear a mask to wear a mask. If you believe the narrative and you believe that your mask is helping you stay well, then wear a mask. But you can't ask a child and a parent who don't believe or share that belief with you to do the same. It's not right. You know, masks make it hard to hear and hard to see, and they obscure your facial features. And like I said, there's been data from the beginning of this from OSHA that was redacted. Nothing was put in its place. But OSHA stated masks don't work long term. After 20 minutes, they become moist and they cause bacteria. So kids are, you know, I just don't have to say much more about that, except for there was another study recently from the JAMA report that also showed how dangerous it is for our children to be breathing carbon dioxide after 3 minutes. Their carbon dioxide level is toxic, and it causes cellular damage. It causes headaches. It causes brain damage. It causes long-term damage to our organs. So I just don't think it's right. I don't think there's enough study on the back end to support a mandate. So thank you so much for what you are doing, and I was so happy when your first report came out. I just hope that you can stay with it. Thank you.
Thank you. Thank you for calling in to share your thoughts with us. Is there anybody else on the line who'd like to share?
Hello.
Hi. Go ahead.
Hi. My name is Mary Dominguez. I live at 9 Farmfield Ridge. And I would just like to say that I think it is worth considering updating the mask policy for this coming school year, as things have changed since it was written in June. I think that I know that at this time there are a rise in COVID-19 cases amongst unvaccinated adults and children, and that the Delta variant is 75% more contagious than the original strain of COVID-19. I feel that if the CDC is now recommending everyone, vaccinated or unvaccinated, wear masks when they're indoors, that our kids should also. So I hope you will seriously consider changing the policy. Thank you so much for your time.
Thank you. Thank you for your time. We appreciate your calling in. All right. Is there anyone else?
Hi, yes, my name is Justin Burtwell. I live at 13 Roosevelt Drive, Newtown, Connecticut.
Can you repeat that? I couldn't quite hear what you said.
My name is Justin Burtwell, and I live at 13 Roosevelt Drive, Newtown, Connecticut.
Great. Thank you. Thank you for repeating that. Go ahead.
So I want parents, I urge that, thank you for all the service that you're doing. And I was very pleased with the level of discernment and judgment that you offered in your previous judgment regarding masks. And I would just ask you to keep that policy in place and remind just, I guess, 2 points I'd like to make. It does seem like there is credible evidence that this Delta variant is having an impact on our public health. And that maybe there are rates of higher incidences of impact on children. So I don't know if that's the case or not. I respect the opinions that have been given for people who perhaps have firsthand knowledge. But I'd also like to indicate that there are also higher rates of anxiety and depression in children. And their inability to socialize is also to be considered. Public health is not just one issue, it's multiple issues. In addition, would like to remind the board that there are countries like Sweden who have never had a mask mandate or social distancing, and they've had very, very low rates of death and hospitalization in their country, and they continue to have these very open policies. There is very conflicting evidence on the efficacy of these masks. The third thing that I'd like to mention is that the Delta, it looks like the Delta variant has already seen ravages in other countries, namely like England and parts of Europe. And as quickly as they ascended, they also came down. So this is not a permanent problem. While COVID will be with us probably for a very long time, this is not something that I think we need to make major changes to the policy. If parents are concerned about the Delta variant, they can hold their children, or they can ask them to wear masks. But you should allow parents to make the decision and not mandate a coercive policy. Thank you very much.
All right. Thank you for calling in and sharing your thoughts. Appreciate it. Is there anybody else who'd like to speak?
Hi, can you hear me?
Yes, go ahead.
This is Liza Llewellyn again. I'm sorry, 2 seconds. I'd just like to point out that in those countries where their rates of hospitalization and illness and death was lower, it's because they didn't allow anyone out of their houses and they were assigned times to go food shopping.
Call a point of order, please.
Yeah.
This is not it's not a public discussion. We're not, this is a,
I was
people are
making a point. Thank you.
Yeah, thank you. I appreciate it. Thank you. That you're right. Thank you for that point of order. We do need to allow
follow Robert's
everybody.
rules.
Yeah, no, and everybody, each public speaker gets their time. And then, yeah, we don't need to start a debate between our public speakers. Is there somebody on the
Can you hear
line?
me?
Yes, hi.
Yes, there is. Can you?
Go ahead.
Hello. Hi, my name is Paul Ribeiro. I'm calling from 12 Wills Road in Newtown.
Okay, go ahead.
I want to start off by just saying thank you very much for everyone on the board and for our teachers and administrators for everything that you've done for our students this past year. It's obviously been a very challenging year for everyone, and we really do appreciate everything that you guys have done. I do want to advocate for our educational leaders to listen to the public health people who are specialists and not to fall under any pressure by the public or politically. Our medical experts are very well versed of all the articles and the data that's out there, and their opinions are extremely valid, and that's what should be guiding any type of decisions moving forward. And hopefully it's not anything that is politically motivated. Again, I feel that the wearing of masks right now, if our public experts say that is the way to go, I agree. I personally believe that some of the articles that are out there are misleading. If you ask a surgeon who completes surgeries, I feel that most people would not ask their surgeon not to wear a mask during surgery. They are totally safe and are fine. But I do agree that our students' anxiety and their mental health is having a major impact on this, and that as school leaders, again, I am very appreciative of the efforts that this district has taken to try to address some of those concerns. So once again, as our leaders in this educational environment, I do hope that you follow the guidelines listed by the medical experts and don't let other things impact your decisions moving forward. Thank you.
Thank you for taking the time to call in. We appreciate it. Is there anybody else who'd like to address the board?
Hello, my name is Don Lococo. I live at 27 High Barlow Road, Newtown.
Hi.
Hi, I'm calling as a person who has been a temporary school teacher for Newtown school system, also been here since 1994, that I feel that the Board of Ed that we have is very well educated on the public health crisis that we're involved with concerning COVID-19. And I'd like to just put my support in with you all concerning making sure that we follow the Department of Public Health and the Department of Education recommendations concerning masking for this coming school year. Thank you.
Great. Thank you for phoning in. We appreciate it. Is there anybody else who'd like to address the board?
Hi, Michelle. It's Trent Harrison.
Hi.
Trent Harrison, 59 Platts Hill Road, Newtown. I speak before you tonight as a person who wears many hats. A parent who is concerned about his children, their education, and their safety at Newtown High School. A faculty member who is concerned about the students and their education and safety in the high school, as well as my own safety and job duties and responsibilities of delivering instruction to all the students. And as the union president, who is concerned about the safety and workload placed on all of the certified staff across the district. The past year and a half have seen educational instruction adapt quite quickly to the ever-changing scenarios we face with the COVID-19 pandemic. The faculty rose to the challenge, gave their best efforts to keep high expectations, delivering the curriculum in new and engaging ways. Hopefully this summer was used to reconnect with family, take that trip that was postponed or canceled last year, and relax and recharge. We understand that in the next few weeks and months, we will have increases and decreases in positivity rates across the state. We are looking to you for clear directives that are consistent across the district schools, grade levels, academic disciplines, and electives to the furthest extent possible, so that the most remarkable group of teachers I'm proud to represent and call my colleagues can continue to educate the children of Newtown. Thank you for your time.
Thank you for your time. Thank you. All right, we will open it up to the next speaker. Is there anybody else who'd like to speak?
Hello?
Hello?
Oh, we
Hi,
have,
yes. Oh,
yeah, go ahead.
my name is Galen Rouvier. I live at 2 Golden Pond Road in Newtown, and I'll just be brief. I just want to voice my support for mandating universal masks. It's much more effective than just an individual. And if you do not mandate universal masks, then you really need to offer the option of distance learning, because our children are not going to be safe without that universal mask measure. Thank you.
Great, thank you for calling in. We appreciate it.
Hello.
Right. Yes, hi.
Hi, it's Mike Capola, 26 Beechwood Drive in Sandy Hook. And just two things I just want to get out is, one, that the kids were so happy to go back to school, regardless if they had to wear a mask or not. They hadn't seen their friends in a year, and they were so happy to go back to school, they didn't care about the mask. Number two, let's keep in mind and not forget that the current vaccine is only for kids 12 and up. So we can't forget about the younger kids. So what's going to happen with the younger kids that cannot get vaccinated right now? And if parents want to think about things or worry about things, one of the things that they should be thinking about is when they're having guests and company over and when they're going to functions, how are they properly distancing so that their kids aren't spreading it around? And that's it.
Great, thank you for calling in to share your thoughts with us. We appreciate it. Is there anybody else who'd like to speak? Anyone? All right. Oh, did I hear somebody? No. Okay. I am going to close out public participation then and resume our meeting with, we left off, and I appreciate everybody calling in to share their thoughts, as well as those who emailed the board. There's a lot of information that everybody's taking in and sharing. I appreciate it. And then I will turn it over to Dr. Rodrigue for her update.
Thank you, Dr. Koo. I'm just going to start very briefly talking about our administrative retreat that was held at the newest Ed Advance CES facility. Tanya was there, as well as all of our administrators at Workspace Connecticut in Bethel. It's a beautiful facility. I know, Dan, you've been there as well. And it certainly became the center of discussion for us about other programs that might be offered there to add enrichment for our students. And we can certainly talk about that, and we will at a later date, but they have everything from black box theater and animation studios and technology. It's just really an amazing, amazing place. Our focus, just so you know, for the 2 full days was really on bringing our students back in full and being mindful of the academic and emotional supports that we know are surely needed for our students. Not only so they can meet with success, but feel confident coming back. Many who have been out and others who are, I'm sure, excited to come back will be able to really excel in a place, a safe and positive culture that we want to exist in all of our buildings across the district. I did invite Jonathan Costa. He's the Ed Advance Assistant Executive Director to discuss, really just bring us together and talk about the lessons we learned over the last 18 months and turning that into opportunities that we need to embrace as we come back to school. Ann and Frank also worked with our A team on EduClimber, and that will, that's new. It will house much of our academic and other data. So we'll be able to, with what I think far greater ease, identify students who really truly need support and make more informed plans to help them succeed academically and emotionally. When our students do come back, as I told the Danbury News Times the other day, we do need to focus on the confidence we have in our students and staff that they will catch up and do well, rather than hearing, I know as adults we throw around things like learning loss and deficits, but we really want students to feel confident that we're working with them. So our entire retreat focused on finding ways to make students feel that there is a positive, although it's been a very difficult 18 months, welcoming them back and giving them the tools that they need to achieve. And that was truly our focus for the year. And I know that we're going to be working with our staff when they return as well. As we get closer, I will be sending out a welcome back communication to parents and staff, and I will outline a lot of the same messaging that I know our principals will follow suit as well. So it was a great 2 days, and we have a great team. I just want to point that out, and I think they're all really ready to come back, and I know they're doing a great job pulling things together to welcome our students. So that's the end of that report for the evening.
Great, thank you.
You're welcome.
There's more to report on later agenda items. Okay, much appreciated. Does anybody have any questions on that? Or I know I gave you a little update on what the Department of Public Health and State Department of Education shared yesterday. All right, so we'll move on to our item number 4. So
Mr. D'Elia has his hand up.
yes, Mr. D'Elia.
Oh, thank you. Michelle, I just want to ask a follow-up question to something you said in your report. You said that now the governor is requiring students to wear face masks, right? Am I right in understanding that his new executive order requires students in schools to wear face masks?
So the executive order number 12A has not changed at all. The executive order number 13 actually renewed executive order 12A, which directed the Department of Public Health to give the guidance. It's more than guidance, it's a binding guidance that school masks must be worn in schools. And so that has never changed. I think there was some public information from the state, the governor, regarding the possibility of that changing over the summer. It has not changed. It has remained in effect, and Executive Order 13 extended it through September 30th. So essentially right now, as of today, masks are required in schools. And I mean, the governor has indicated that things might change over the summer, but the Department of Public Health has indicated that the COVID rates are going up, and they also reiterated that the executive order is still in place. So that's where we are today.
Thank you.
Yeah. Ms. Zukowski?
So do we know broadly that the rates are going up, or do we know more locally, specifically what's really going on within our local area?
I mean, the state certainly provides the numbers for Newtown every day, and everybody's welcome to go to the state site and look at those numbers. I keep track of it. I don't believe our regional educational service center was keeping track of that for us for a while.
Yeah, so I'm sorry, if I may?
Yeah, go ahead.
It looks like Reading is got an increase in cases from what I looked at the website. Newtown is still under 5 cases. But in terms of locally, I mean, it would be nice to have a really tight understanding of how the Delta virus is affecting our local area, whether that's just Newtown or Newtown and surrounding towns.
Yeah, I mean, that number of less than 5 per 100,000 that you're citing, that's a number from last week. That's not this week. And just from what I'm seeing, there have been increases in cases over the past week. But, I think I don't know if the regional educational service centers will be continuing that service for the school districts in their region. Do you know that, Dr. Rodriguez?
I do not, but I believe as soon as school gets started, when everyone's back, it's easy to get that data. And it does change daily. So you have to keep up with it. But I do talk about a lot of what you are all discussing now in my report.
Sorry, Lori.
No, that's okay. That's okay. Well, first, do you want to move on to that, Michelle, at this point, as long as they're asking questions?
Dan, Mr. Cruson, did you have I saw your hand up. Did you have a question or?
No, it was more of a comment, but I can wait.
Okay, so we'll continue with our item number 4, and I'll just say that so this is discussion and possible action on authorizing the superintendent to make changes to the return to school plan. So this agenda, we'll give some background information, and then we'll work on the motion after we have some of the background information. So just for everybody's information, this agenda item was added to allow Dr. Rodriguez to make changes to the plan. As indicated, the executive order is currently in place, and our plan doesn't agree with the executive order. Things could change. The governor has not given any indication of what might change over the couple of weeks before school starts, but I think the alternative to this item would be that we would need to approve changes as needed every time there's a change in the plan for whatever reason. So that's why this agenda item is on here. And so at this point, I don't know, Dr. Rodriguez, do you want to give us some background before we make the motion?
Well, I wanted to go through a few things.
Okay.
So maybe I'll do that. First, I also, as you said, Dr. Koo, wanted to thank staff and families who continued to send very respectful opinions and messages and offer their input. I do understand, trust me, that everyone in this has a unique and different perspective as they approach any topic, actually. And as adults, we should always be mindful of that, even if it doesn't necessarily fit each of our own beliefs or viewpoints. And I know I've taken a great deal of time to really listen, to respond to emails if they come my way, and to take all of those viewpoints into consideration. But I do have to say there are some things that I think there's a misnomer, and I've answered this in every email that I've responded to. The misnomer is that we have some flexibility here, which was one of the things that I put in our plan purposefully, because I knew we may not have that as we move forward and get closer to school. And that was weeks ago, correct? When things were very different, and the executive order, as you mentioned, was sunsetting at that time. Our most important goal, I think, is getting students back to school in full. That was really our focus in creating that plan, ensuring that all of our students have the academic and emotional supports that they need. And that is also part of the plan. It is not simply about mitigation strategies, although that is certainly why we're here this evening, to make some changes. The only impact on our original plan, well, there are a couple of things that we developed weeks ago, and as you know, was subject to changes based on clear evidence of community spread and hospitalizations if we started to see a surge, if you will, whether it was locally across the state or both, as well as the extension or changes in the governor's order. Dr. Koo, you mentioned 12A and extending that through 13. That has not changed. So that will go all the way through September 30th. So while I really do appreciate all of the input, and sometimes you feel helpless because you know you want to go a certain direction, as I would have a month ago, but there are some things that are just truly out of our control. And I've had multiple conversations with parents, and I think all of the parents that I spoke to at least understood that one simple fact. And so I just wanted to clarify that. Based on current information as we have it today, we will need to move to masks for all based on that executive order, at least for now, which is in concert with the DPH recommendations. But please know that things are fluid, and we will share that changes. We can hear something completely different tomorrow. We have been waiting for additional guidance that we keep hearing about coming our way. And I think that's what really drove many other districts as well to just from the get-go go to masks, because changing it like this. And if you recall, I did bring that up originally. I wanted to move in that direction, but again, I knew that it could be problematic if we had to change on a dime as we are. Masks are required on bus transportation. There's actually no argument on that. That is something that has been in place, and we would needed to have changed that anyway. So on buses and in the school setting at this point in time, and that's both vaccinated and unvaccinated. Again, if a change is made regarding students or staff, vaccinated or unvaccinated, then of course I would be sharing all of that with each of you and certainly all staff and all of the community at large. It is fluid. We will continue to reevaluate this, as I'm sure the CDC will do, the DPH will do as we get closer to the end of the executive order. But there are other things that I wanted to also mention and emphasize as long as we're talking about this evening. There have been questions all along on quarantining. And Dr. Koo, I think you brought some of this up. That was changed and communicated by the DPH as that 3-foot minimum when it comes to contact tracing. That's a huge change for us, because I know we ended up last year quarantining lots of students, far more than should have been. Once again, we were following the science, at least what we were told at the time, and what we needed to do. And that.
Oh, Lori, you just muted yourself.
Sorry about that. And so that's going to help us a lot in terms of how many students we have to actually quarantine, which is less than that 3-foot radius. And that will change a lot. This will help, I think, greatly avoid all of the, the large number of students that have to quarantine. It is still at this point the 7-day, which is acceptable with a 5-day negative COVID test. So until I hear otherwise, that's where we have to stay, at least for now. Anyone vaccinated will not have to be quarantined. And that again was something that we were happy to hear about. So we will be encouraging families, just so you know, and staff to share at their discretion any vaccination status with the school nurses so that we can make sure that we're not over quarantining or asking students to quarantine when they do not have to. However, we will still report, we are being asked, even if we do not have to quarantine those staff or students who are vaccinated and have readily shared that with us, we will be still reporting to them if they were in close contact, just to be transparent. There have also been questions around special education services if a student who happens to be in a special ed population needed to be quarantined. So I did have an opportunity to talk with Deb Peterson, our director, and other key staff regarding services, those that are legally binding in an IEP, that we will provide services. Certainly, we're legally bound to do so if a student should be quarantined. We're going to be working with staff again as they return to develop plans as to what that will actually look like. I will tell you that we don't have the D cohort, as many districts are not obligated to do that any longer. However, if a student is quarantined, we will be, as I mentioned at a previous meeting, I believe, having a qualified building sub work with students with the Google Classroom and the work that is there. And so I've already talked with teachers through the teachers union, and we've had multiple discussions about putting work up on Google Classroom, but students will no longer be able to just drop into a classroom. Many teachers will not even have their cameras available anymore because there will not be a cohort D. But I wanted to assure families that by design, we will be supporting students in every way possible. Again, some other points that I wanted to just kind of make sure we were clear on. We're working on schedules for lunch so that students will have adequate space when they're eating, as the guidelines are to provide as much space as possible. I know my principals, they urged us and encouraged us to add as much space as we could, and even to add lunch waves so that you can spread students out as much as possible. I know that some of the tighter elementary schools were eating in classrooms, which, by the way, was perfectly acceptable at the time because of spacing, that we may have to rotate some to eat in classrooms, maybe once a week or twice a week, but we are really trying hard to get all of our students back into cafeteria at some point. So I know that, for example, at the middle and high school, they'll be looking at lunch waves so that we can try to make sure that we get students into the cafeteria, but with the appropriate amount of space as well. We will continue to bring students outdoors as much as we can, weather permitting. I know some of my principals have asked about using tents again, and I said, absolutely, if we can do it. For example, the high school I know has done that and had them up for quite a while. So we will be revisiting that. We will no longer be utilizing the desk shields. We really don't feel, or neither did the BPH feel, that they were particularly effective. So we will not be utilizing those this year. We will certainly encourage mask breaks, again, not just going outside, but wherever we can take students to do that. We'll make sure that that happens frequently. And I know that parents will receive information from the various building leaders before school starts about many of the expectations and the design of what the days will look like for their students. before we return. We have plenty of masks, we have plenty of hand sanitizers, all those sort of mitigation strategies that are still recommended for all of our students and staff when we return. We know that this has, I can tell you, we know this has caused a division and a ton of differing opinions, which is perfectly understandable. This has been back and forth. There have been mixed messages. People are confused. Some are reading certain studies, others are missing those studies. So it really is, I think the point to drive home is that we don't have a choice right now. We don't. And I think with the two things that we put in our plan very clearly was one, continuing to look at health metrics, working with our local health department and the DPH, and two, to make sure that there were no other executive orders or mandates in place, and there are, at least for now. So I know that once students are back, they will hopefully continue to feel that they're in a safe and positive environment, and hopefully things will improve and continue to improve as vaccination rates go up and as the health metrics continue to remain in good shape. I think Newtown has done an incredible job, and I want to emphasize that. I think that speaks volumes to those who live here and the residents and families who I think really do care and have taken precautions. My role, as I just have to say, as difficult as it is, I still have to comply with state mandates and provide for you as board members instances when there is flexibility or when choices can be applied. I think you are all well aware of the direction we wanted to move in, but given those changes that I've just outlined, it's just not possible for today. Again, I do not know if further information will come. That's been very disheartening, I think, over time, because we haven't had, I think, what we wanted to hear early enough. We're going back to school in less than 3 weeks. Teachers are coming back even before that. So I will continue to provide updates and when things change, and if there are further flexibilities that we have, then we certainly will discuss that. And I want to do this with the local health director as well, to make those decisions when we can, perhaps moving in a direction again that is again safe, and that our priority is for the well-being of all of our staff and students. And that is, you know, certainly the most important thing. And I hope that all families understand that any decision we make, we don't do it based on any one group. It is based on listening to health experts and knowing the flexibilities and looking at the local landscape in terms of the health metrics and so much more. It's a very difficult decision that we're tasked with, but at this point we do have to follow the state. So I wanted to just share all of that with you this evening and open it up to questions.
Anybody have any questions or?
Do we want to get the motion on the table first?
Yeah, so just to be clear, before we make the motion, the specific things that would need to be changed right now would be the transportate in our plan would be
it's the masking, the transportation, of course, and the masks in schools.
And the cafeteria space, right? Like, because I think the original plan said that students would be eating in the cafeterias, and there's a possibility they may not be.
Well, no, we always had the possibility of using classrooms, so I don't think much change there. I may make a notation there that we're going to try to get as many as we can into the cafeterias. That's our goal. So I think I'm just thinking of the two. Middle gate is one. You may have to eat on a rotation. They might have to eat one day in the classroom and the rest in the cafeteria. So if there's a change that needs to be made there, I can outline that as well.
And then the only other question I had about the current plan was the volunteers. Are we still allowing volunteers into buildings?
Yes, nothing's changed on anything other than the masking.
Okay. So knowing that those are the changes that currently need to be made and that we would need to
Michelle?
approve. Yes,
Sorry, I was raising my hand. You probably can't see me.
I can see you, but I was going to finish my thought.
Sorry.
No? So I guess I just wanted to make clear what the current changes are that we need to think about making in the plan. And then everybody knows that this is directing Dr. Rodrigue to make any changes in the future that need to be made to the plan without the board having to approve every single change that comes up. All right. All right. So Mr. D'Elia?
Yeah, I was just going to comment on it. We're not voting on changes. We're just voting on giving Lori authorization to make changes in a fluid situation that's literally changing daily. And rather than having to call a Board of Ed meeting every time something changes, hopefully for the better, then that's what we're voting on, right? We're not voting on the change. We're voting on letting Dr. Rodrigue make the change.
Exactly. Yes. Thank you.
Including the changes that you just outlined. Those are not something we're voting on.
Exactly. Yep. Thank you for clarifying that. Okay. So would you like to make the motion? Or are there more questions before we make a motion? Ms. Zukowski? You need to unmute yourself.
I just am curious about a clarification on the mandate of the masks. I mean, the Department of Public Health is mandating masks. I understand that, and I fully understand the reasons for it at this point. But I'm sure that they have exceptions for students for which masks significantly interfere with their ability to engage in their education. And I'm just wondering how such students are identified, or if we have a method, if
So
that's
we had-
part of the plan.
Yeah, so that was in play last year. That has not changed. There have always been those exemptions. So that usually goes from the family to the local nursing supervisor, Ann Dalton. And she usually looks over, I have to be honest with you, and that included how many students in special education who had multiple issues. And there was no problem with masks at that point. Will we have some now? Yes, I think we will. And that will go through the family, talking with the nursing supervisor, making sure that all of the, the doctor's order, clarifying what that is and that it really truly meets the exemption, would it be handled through the nursing supervisor, Ann Dalton.
Okay, thank you.
And she took care of that all year, so that is not new to any of this right now.
Okay. Shall we entertain a motion at this point?
I move that the Board of Education authorize the superintendent to make changes to the return to school plan.
Second.
All right. So Mr. D'Elia makes that motion and Mr. Cruson seconds the motion.
Actually, I'd like to amend my motion, if that's okay.
Go. Yeah, go ahead.
I'd like the word I'd like to add the word as needed to the end of the motion, if everybody's okay with that. Because this seems like she's only going to make one change today.
Yeah.
And I want her to be able to, I want Dr. Rodrigue to be able to make changes, which I'm going to ask questions about after the motion.
Yeah. If
Does that
that's
make
okay.
sense?
How about going forward?
That's fine by me.
That is both as needed and indicates that it is for an indefinite period of time, not just for tonight.
So just adding the words going forward
To the end. Yeah.
Is that
It's fine by me.
okay? So
I'll read it again.
Yeah, why don't you do that?
I move that the Board of Education authorize the superintendent to make changes to the return to school plan moving forward.
I still second it.
Okay. All right, so is there any further discussion or questions or comments? Yeah, Mr. Cruson. And then Mr. D'Elia.
Actually, since Mr. D'Elia made the motion, I think he should get to speak to it first.
You're right. Okay.
Thanks, Dan. Mr. Cruzon, excuse me. Dr. Rodrigue, I wanted to ask you if you could, and I think you've already spoken to this, but if the governor changes his plans, will you, I guess, what can the community expect as a response? Because I'm sure what's going to happen is the governor is going to make an announcement in a month, and then everybody's going to be asking you, what are you doing? And I'm just, maybe if you could speak to this in advance, we could get ahead of those.
Yeah, absolutely. I don't know if I can answer that in any one way because I don't know what that information could be. The only thing that might change are vaccinated versus unvaccinated. That's the only change I think might happen in such a short period, which is prior to the start of the year. But right now, that's not happened. And it's very clear across Connecticut that just in talking to my colleagues in other districts that pretty much everybody's going back in masks because that's what the order is right now, giving that authority, of course, to the DPH. So, you know what, Mr. D'Elia, I think we have to wait and see what changes there will be, and there will be some, and go from there and decide, you know, is that a good decision to make, and do we want to follow that? I think that, I don't think there'll be a mandate. I think it will be flexibility, if anything, because we have the mandate. It can only be more flexible now at this point from what I see.
May I follow up, Dr. Koo?
Go ahead.
And I just want to close with, you know, Dr. Rodrigue, I've been on this board for 4 years, and you've always made decisions in the best interests of the children. And I'm in full support of letting you make these decisions in a timely manner. Thank you.
Thank you. I appreciate that.
All right. Mr. Cruson, did you have questions?
Comments mostly. Actually, completely. I feel that I do agree with this. I'm a little surprised we didn't do this when the plan originally went into effect, because it seems like it's a necessity that the superintendent who is best positioned to make these choices quickly be authorized to do so, rather than having to come to the board and manage to get a group of at least 4 people together anytime it changes, because this is a very fluid situation, especially seeing what's happened since June, though. I mean, even more so than over the last year, the decisions clearly are needing to be made fast and furious. I mean, everything that's happened has happened in the last 3 or 4 weeks, it seems. So I am in support of this. That said, I do hope that this goes both, that this power, that you feel empowered to use this power both ways, both when we need to tighten down, but also when we need to loosen, that we aren't dragging our feet if things get better and we know things can be loosened up in some way, that we're acting on that just as quickly as we do when it's time to tighten things down. And that you just keep the board apprised of the changes being made. Sometimes I know board members, myself included, when we're taken out of the decision-making process, we feel like we might get left behind. So just letting us know, I'm speaking mostly for myself, but I think I may be speaking for other board members as well, that we'd just like to hear when changes are being made and just being kept apprised of things, since we are essentially surrendering a lot of our decision-making power here.
Very good. Ms. Zukowski.
Yeah, so Dr. Rodrigue, I know that it's really, really important for you to instill confidence in your decision-making process across all of the stakeholders, and that you work really, really hard to do that type of thing. I will second what Mr. Cruson was saying in that it just seems I'm a little uncomfortable in that, decisions are made, but I don't know under what framework they're being made. So like, I know you have an objective to try to keep the schools fully open, but I'm willing to bet there are other objectives you have also. So, to know what those objectives would be that you would want to drive your decisions would be very helpful for making me more comfortable. In terms of the data, are we going statewide or are we going to be going local? What is the vaccination rate for the Newtown community? What is the vaccination rate for our various schools, middle school and high school in particular? How many cases? I don't, the positivity rate is something that goes up, everybody comes home from vacation, they all get tests and the positivity rate goes down. But, in terms of how many cases actually have been in Newtown, say over a 2-week period or whatever. Additionally, things like, does anybody in the Department of Health know the ratio of symptomatic to non-symptomatic carriers? All of that would help me feel, having more access to the information for which you make your decisions and the framework that guides your decisions would make me feel a lot more comfortable.
So I would recommend that we again bring the local health director when we're going to make any changes, if we get to that point, because those are truly, we are supposed to act together with the health department, both the local and state. This isn't a superintendent at a whim decides to change the course of what we do. And I just want to clarify that. It really has to be with the medical. I'm not a medical expert. I don't pretend to be. And I want to make that very clear so that when we get to that point again, where data is important as to why we're moving in whatever direction, if we get the flexibility to do that, that's the key. Are we being, mandated to do something or required versus we have the flexibility, then that data, wherever we are at that point, because that changes very rapidly, as you know, then I would want to make sure that we invite those who also help make those decisions. That is something I think we haven't emphasized enough. Every district works and has to work with their local and state health. Those are the experts. I think someone mentioned it on the phone. That's very clear. We're not the experts. I can't listen to any one given, as much as people might work in that field, I can't just listen to anyone. I am bound as a leader to listen to those local and state health professionals. But when all of that information together with very obvious data that anyone can get, it was coming to us weekly, and I can get any of that information daily as we were looking at cases. But I think what you're really looking for is if we're going to make a different change, meaning optional masks or whatever it is, whatever flexibility. First of all, we have to have that ability to be able to do that in that particular realm. Then we would definitely have information, and that decision will not just be made frivolously, I should say, without a lot of data that we do whenever we make a decision. That's why it's not really about any one group. I mean, we all have various opinions. You heard that this evening, but I would talk with Donna Colbert. I would be on with the DPH. I would look to see what our data is in Newtown. There are a variety of variables that would impact that decision. So it's made with the students and teachers' best interest in mind. That's there's my objective. And I think I've said that again and again. Clearly, that has to be the objective.
So what I'm hearing from board members is that I think it's not that this has been the history of the board for the past I don't know how, your tenure on the board with us, Dr. Rodriguez, that you will update us when things change, and often look for input from board members when it's possible to do that. And I think the idea is that there are sometimes when a decision needs to be made without, between board meetings where it's that we need to authorize you to be able to make those changes. And that's not unusual. Most boards around the state of Connecticut have delegated that responsibility to their superintendents. It's just that we were very early in the process last summer when the board approved the plan to return to school, and not all boards in Connecticut did that. So we kind of started a precedent, and this is changing that a little bit. So I understand the hesitation to sort of give up that board, power. But I think it's not going to be any, I hear everybody, and I think that we do need to, we are communicating that we would like to have updates and have some input on things and decisions as they do come up. But that's sort of, and so the benefit of having the board approve things is that the superintendent is not out on her own making decisions by herself, and that she has the support of the board in the decision. So that's the benefit of running things past the board and making sure that everybody is running in the same direction. So, there's definitely motivation to share things with the board before making decisions, if at all possible. So I think that's my comment, not a question. And what was the other? Oh, and one other thing. Oh, I'm sorry. I'll let you go ahead, Mr. D'Elia.
Go ahead. You can finish, Michelle. It's fine.
It's a totally different thought. So go ahead.
I just wanted to piggyback on what you were saying, and also Dr. Rodriguez knows what the board's feelings were. We wrote a letter to the governor, so we've made it clear as a board. We voted on it. And I just wanted to kind of add that to what you were saying, that it's not like the board's intentions are going to be disregarded. They should be considered, and I'm certain they will be. I think this is more to be expeditious and make sure that we're doing what's best for everyone, all stakeholders, in a timely manner. And I guess I'll end at that. Thank you.
Okay. I'll follow up on that and just say that the plan that we did put together certainly was done in a different time and space. I know at the time I was planning on, international travel, and we all had our vaccinations and everything was all good. The rates were going down, and things have changed dramatically since then. So just taking that with a grain of salt, that things are a little bit different. And I know that if today, just putting this out there, if the governor were tomorrow to say, you can go back to school and have a choice with masks, I would not be comfortable with saying everybody has their own choice. The way things are going right now, I would not be comfortable with that. And I know that goes against a lot of the comments we heard from the public, but that's my personal feeling at the moment. The other piece that I just wanted to make clear was that piece in the Department of Public Health, State Department of Education, new information about students not needing to quarantine if they're in a classroom greater than 3 feet from a student who's positive. Students need to be wearing masks in order for that to be in effect. So if we have students making a choice not to wear a mask and students that are wearing masks, that there will be students that will need to quarantine. And that's the first time that really there's been any consideration of the use of masks in any situation. So I was glad to hear that, because I do think that we do need to reduce the number of students that we're quarantining at any one time. All right, I've spoken enough. Does anybody else want to add or ask anything? Mr. Cruson?
actually have, it's a question / comment. Dr. Rodrigue, when you talk to Donna Colbert, I mean, obviously when you're talking to DPH, you're taking into account, those discussions account for more than just what's going on in Newtown. When you talk to Donna Colbert, is she also considering at least somewhat the surrounding area and what's happening around Newtown, or is she purely looking in Newtown?
So she doesn't just do Newtown, so she does have another, you know that, another district.
Roxbury and something, I can't remember.
In Litchfield County. So she certainly knows what's going on outside of Newtown, and they like it, just as superintendents talk, our local health directors also meet and talk, so they share data. But she has data readily available to her as well. And so while she really looks at the data in Newtown, she certainly understands what's going on around Newtown as part of her role, I'm sure.
Okay, the reason why I asked the question is because I feel a lot of people have talked about how, oh, it's doing this in Newtown, we're doing this in Newtown. It gives a false sense of security in some ways, because a lot of our staff especially come from surrounding areas. So if you're looking at possible transmission patterns and where it might be coming from, even with the most recent data that says someone who's vaccinated could be, I mean, I know someone, my brother-in-law was vaccinated and still came down with it. And they're now saying that those
breakthrough cases for sure.
And they're saying that while we're seeing more of those, they're also seeing evidence that it could be transmitted by those people. So just looking at Newtown doesn't necessarily give us the whole picture, and could give us a false sense of security with the amount of staff and even some students that we have come from those surrounding towns. So I wanted to sort of be transparent, I guess, in the fact that yes, we can look at Newtown, but we should be at least giving some consideration to what it looks like outside of town, because that could play a part.
Yeah, good point. Mr. D'Elia?
I guess I just wanted to ask a follow-up to Mrs. Zakowski and maybe Mr. Gruson. Are you not in support of this motion, or are you in support of amending the motion to put maybe, I don't know. I'm just curious, hearing both of your comments. Thank you.
Ms. Zakowski?
I would probably feel, I understand that, we're at the crux of a change right now, because I agree that all sorts of, that vaccinated people can actually transmit, asymptomatic vaccinated people can actually transmit the virus. That is a little disturbing. So we're at a crux of a transition right now, with all of that going on and all of school starting. And I understand the need for rapid change of course, but I would probably feel a little bit better if we were to put a time limit on it, say our second meeting in October, to revisit this motion. And that would give us enough time to maybe get over all of this uncertainty, learn more about what the vaccination rates of our high schoolers are, the vaccination rates of our middle schoolers are, learn more about the interplay between Newtown and the surrounding areas, and and learn more about the framework, because I'm sure there will be a framework for which these decisions are being made, and then revisit that. So I would make an amendment that this motion be that we review our authorization at our second meeting in October.
I think that needs a second, right?
Yeah.
I'll second it for discussion.
Okay, so Ms. Zakowski's amending the motion to add that we revisit this in October. Mr. Cruson, are you raising your hand or are you just?
Well, I sort of can, I could answer Mr. Delia's question and speak to Ms. Zukowski's amendment at the same time. So
Great.
maybe I'll jump in and kill two birds with one stone as it is. In answer to Mr. Delia's original question, I am still in favor of the original motion. I feel that it is in the best interest of the health and safety of the school that the superintendent be able to make expedient decisions in regards to this. Just looking at what has changed in the last 3 weeks, waiting and only being able to make changes every 2 weeks, I don't think is going to serve us well. So I think it is important that the superintendent and the administrative team feel empowered to make changes as needed to address situations as they arise. I'm on the fence about putting a time limit on it because I feel like even if we don't put a time limit on this particular motion and the authorization, we can still revisit it in the second meeting in October. We could always make a motion to revoke said authorization at that point. If we do put a time limit on it, that puts a little more pressure on us because we have to make sure that at that meeting we remember or we choose to reauthorize it or it would lapse. So I think I'm a little more comfortable leaving it open-ended and saying we will revisit it in October and then revoke it at that time if we feel at that point it makes sense. But because I feel that this is probably the best path forward to ensure that the health and safety is maintained at the school district, I think the open-ended one probably would serve us better.
The open-ended one, meaning not adding a time.
The original motion prior to this current amendment.
Got it. Mr. Delia?
Mrs. Zukowski, would you be in favor of supporting it if it said something to the extent of the 2020-2021 return to school plan? So at least it ends at the end of the school year. It's not just which I don't know if that would be something that would garnish your support.
The
21-22. Yeah, maybe that would make it would be for the school year. Mrs. Zukowski, would that be something that would?
I liked what I heard Dan Cruson say in terms of just to make sure we do at some point have the ability to revoke and take back the decision-making for the board at a time that we, with the agreement of everybody, would feel that might be best for the board and for the school district as a whole, because we take some of the heat off the superintendent by doing that. So if that's a possible way of managing things, then I am okay with that way and am happy to rescind my motion. But I just want to make sure that that is legal for us to do by Robert's rules.
By Robert's rules, once you have a second on a motion, it really belongs to everybody, and so you can't rescind.
No, I meant what I'm asking is legal is if we can later on revoke something that we had voted previously to provide.
Oh, in other words, in October, could we decide, yeah, no, we want the board to be part of the decision-making process and make a motion to that effect? Yes, we could do that.
Okay, then I'm good.
I'll just say, oh yeah, Mr. Delia.
I didn't raise my hand. You go ahead, Dr. Koo.
I just, everything you said, Dan Cruson, I agree with completely. I sort of am on the fence about it. And I do see the value in putting a timeline on it. So it sort of, we're saying up front, this is something we want to reevaluate, but I think I like the plan of just revisiting it in October and deciding then without actually putting a time frame on it. Mr. D'Elia?
I was going to call the question on the amendment.
Oh. Okay. Good thing you didn't do that before I spoke, because, okay. We actually have to vote on calling the question. All right, so, and I can't remember if you need a second on it. I don't think you do. All right, so all those in favor of voting and calling the question right now? Aye.
Aye.
All right, so all four board members are in favor of voting on the amendment right now. So that means all those in favor of the amendment to add the October timeframe to the motion signify by raising your hand saying aye. And all those opposed? Aye. So all four board members are opposed to the amendment as offered. And that will bring us back to our main motion. Was there any further discussion on the main motion? Mr. D'Elia?
I just, Dr. Rodriguez, I just wanted you to possibly comment for 1 second on the fact that you will be informing us. And I think that's, if you don't mind, I'm sorry. If you could just.
No, that's okay.
Because you inform us every time we meet, you have a chair report and you always look to us for guidance. And if you need our back, if we are definitely part of the decision process. If you could just speak to that for just briefly, I would appreciate it.
Yeah, absolutely. I can't really think of an instance where that didn't happen. So I appreciate the conversation, but that's how it's been all along. And I think Newtown was very unique in that, and I did talk this out with Michelle, that I was appreciative because it was such a serious topic and something that was going to be fluid, that I would garner your support in the plan, and I thought that was important. I know that many districts did not have that. And so, but I think on a day-to-day basis, I make decisions all the time, and much of that is an informational to the board, not necessarily needing a vote. So I think that says a lot. I would not make a change in this way without first making sure you're all aware and understanding what that change would be, because this isn't a little change. It would be something that is impactful. Just given the people that you heard tonight, it's important to them, and it should be important to everyone that we make the right decision and we make sound decisions and we use information that we have, if we're allowed to obviously have that ability and flexibility, certainly. So there's no question and no need to worry about something being made and sent out to everyone but the board. That's never happened. That would never happen. So,
thank you very much. I appreciate that.
you're welcome.
Yes, that speaks to, I think, each of us sort of saying that in different ways. So much appreciated. I just have one last question because this isn't part of the plan, but just a question about the dashboard that we had last year on the district website. Will we be continuing that?
I would suggest that we do, since we are really wanting data. I think it might look differently, but again, I'm hoping that we stay in a really good place. That's what I'm really hoping for as we enter school, and I think everybody's hoping that. But it is important that we get to know what's happening in our schools. So again, that was Ann Dalton who very religiously took care of that and did an outstanding job. So I don't see a reason why we wouldn't continue that.
Okay, thank you.
You're welcome.
All right, any other questions or comments before we vote on the motion? All right, sensing none. All those in favor? Aye. Any opposed? None, so that motion passes unanimously. Thank you for the in-depth discussion. I think that was important to have. And I know we will look forward to the start of a good new school year with all the mitigation factors in place, and then getting off to a good start with little or no spread of COVID. That would be fantastic. All right, so we'll move on to our update on the ESSER 2 and 3 funding.
We do have Kristen Larson here, who's
Kristen
been
Larson.
working diligently with me on trying to put together something that we can communicate concisely on ESSER. And we wanted to just give you a quick update, because in reading thematically the feedback that we received, I wanted to make sure that we clarified what some of the concerns were, or at least some of the topics and themes that came up. So, Kristen, are you going to be able to put that up?
Yep, I can share my screen.
Okay.
And then can you see?
Yeah, we can. Thank you.
Okay.
So just to give you, again, I want to thank parents and staff who did. We didn't get a lot. I think, we had a lot more in response to our plan, but I think, or what the plan should look like, our return to school plan. We did get some stakeholder feedback, and we wanted to share some of the comments and that came up. So as Kristen,
Dr. Rodriguez, can I add to that? Dr. Longobuco did send the survey out also to rising juniors and seniors for some student
yes.
input too.
So we did, again, I wanted to also emphasize that we did send it out to older students at the high school level. So we had students, staff, and community, parents, and guardians. It was open to all of those stakeholders and leaders as well. And so we did receive some feedback as to the ESSER 3. Now, one thing I wanted to clarify, and that's another reason for bringing this up again tonight, is as we read through the feedback, it was very clear that there were definitely, and I could understand why, some clarification needed, because what wasn't required when we had the ESSER 1 and ESSER 2, we did not have to go through putting it out and getting feedback at all. So there were lots of things that we did in making judgments, sound judgments about using that money and what would be the best use of those funds. That was, we saw those same questions come up in ESSER 3. Well, here's one, for example, at the top, spending for elementary schools. Why wasn't enough spent on elementary school, say, versus middle or high school? That was one of the comments that we saw here and there, and we wanted to make sure that it was clear that this is only one, albeit large, funding stream, that we had other ESSER funds, and we also have other grants. So as we go through the themes, we're going to also share with you some of the items that we've addressed using not just ESSER 3 funds, but other funds as well. So spending, these are the major themes: spending for elementary schools versus other schools. Spending, a lot of the stakeholders wanted us to make sure that we put money towards social, emotional, and mental health, that we supported any kinds of tutoring and after-school activities for students, both enrichment and academic support, health and safety concerns, having enough masks and making sure air quality fell into line, which is using the HEPA filters, which I can speak to. There were questions on the purchase and use of some of the assessments, the Fontes and Pinnell, which were outlined in there. And I know that Ann Uberti put together a rather nice response to a parent or parents who questioned that. And then just the fact that feedback from staff and stakeholders is and will be considered. Well, absolutely, that was the point of the process in allowing stakeholder feedback. And note that we can make changes to our plan as we go along, especially in the second year. So, and I know, Kristen, did you want to speak to that about how that might work in terms of any changes that we could make?
Right. So both of these grants, ESSER 2 is open till September of 2023. ESSER 3 is open till September of 2024. So we're able to make changes to the budget as we need to during that time frame. And that just is a process of making budget revisions through the state. So, you know, as we reassess needs this year, or if some costs come in under, or we'll have some flexibility to make changes to the plan moving forward.
There was also a misnomer about using money for staffing. That was very clear by the state that was absolutely allowable. And one of the comments was, well, we don't want to just take off what was budgeted for and pay for it that way. That's not actually what happened. What we did, we were actually adding a lot of the supports before we even knew, you know, that we would have this funding and how much it would be and what we were allowed to use it for. As we were putting together the budget, as you know, we were putting in things like additional interventionists, especially having looked at our data. And I know that the Director of Teaching and Learning did an outstanding job of sharing some of the data that we did have early on, that we would need more interventionists, and that was at the elementary level, and that we would need other mental health, social workers, things like that in our school system to support our students as they returned, that we would look at tutoring programs, after school programs, that was included in other grants as well. So I think when you just look at ESSER 3, the misconception is that that's all there is, and that we didn't do enough for, say, elementary school or social emotional, and that's simply not true. So we're going to share with you, if you go to the next slide, you'll see that we have the Newtown Middle School Teen Talk Counselor through Parent Connection Grant that's paid for. We have Novo Grant, the Novo Grant Foundation. Again, we weren't even sure we were going to get that, but that's $750,000 over 2 years, $500,000 the first year, $250,000 if you recall the second year. That includes, that's where the coordinator of equity and inclusion is. It is not in ESSER money. The Kids in Crisis Teen Talk Counselor at the high school, social workers and counseling services at the high school, but also supporting programs such as Hope Squad, Project Adventure at the lower level, at the intermediate school, the middle school, support for mentorship, mindfulness, which is at every single elementary school. There's mindfulness programming, mindfulness rooms. There's a curriculum that goes along with that, the teacher that paras have been using, and other SEL programs like Second Step. From the Committee for Children, the Second Step program K-8 through 2026. We have our
that just came out this week, that they renewed our license through 2026 and are also giving us access to SEL for adults through that same time period for all the schools.
Oh, that's wonderful. And I didn't even know that. And so Second Step has been our social and emotional learning program. And they just continue to, I would say, revise it so that it is current and relevant and really engaging for students. And now there's a part of that that is actually for an SEL program for staff as well. The VOCA grant, we're in our third year of the 3-year grant for 1214 recovery, and the CHDI, the support for mental health and trauma support groups in our schools. So there clearly is, I think one of the things we have to remember is we've had a lot of support all along, even prior to the pandemic. We've added a lot more as a result of that, some of which we were hoping we were going to put in our budget. And then we're able to, when we found out that we would have money, we were able to offset that so that we can include other things in our budget. So I think it's really clear that we've got enough of the mental health. We feel that we've got adequate mental health supports across the district, not only in certain schools at the high school level, but across the entire spectrum of grade levels. So that's number one. I also wanted to move on and show you the ESSER 2 budget that we're going to post, because once again, although we shared this with you at the time, it wasn't shared the way in which input was asked for from stakeholders, as the state asked us to do for ESSER 3. So we have the interventionists at Hawley, at Sandy Hook, at Middlegate. There's a reading versus the math. We have a full-time math interventionist at the middle school. We have support. One of the things that ESSER monies were supposed to be used for are not only interventionists for academics, but also support for those groups of students who need it, like special education. So a special ed teacher at Middlegate, that was so we can lower our numbers. And the best way when we're talking about trying to catch students up and to really be able to work with them, smaller class sizes go a long way. And to really have smaller caseloads, especially when we're trying to work with students following something like a pandemic. Teachers, special ed teachers at Newtown Middle School, same thing. And a co-teaching model that we are moving to the middle school. We have never had that. That's part of our plan, return to school plan. I hope to continue to look at that across the district. All of the Deb Peterson and Ann Uberti, I've been very vocal about why I think that's very important. When you push in a regular ed, special ed teacher, into a regular ed classroom, it really helps support students. So we are moving that model to the middle school, and ESSER 2 funding has helped do that. That truly, again, is going to help. It's not just about hiring people to do after school enrichment. We know that it has to be at the ground floor. It has to be in the classroom. It has to be part of what we're doing to support students on a regular basis. That is really key in my mind. Can you go to the next slide, Kristen? And I think that's really, that really needs to be emphasized with parents as they read these plans, which probably don't make a lot of sense until they're explained. So all of the digital licenses that are necessary, everyday speech, Ed Puzzle, Super Duper Library, Lexia, Core 5, and Nucella, all IXL, all those areas and technology that do help students. That was one of the lessons we learned. There were many digital resources that we used because of the pandemic that we ended, or even some right before, that we knew really support students. So those are going to be licenses that we continue. Coordinating with the public health department, stipend for our nursing supervisor, staffing costs for district vaccination clinics that we've had and will continue to have, improving our air quality, the MERV filter replacements and ongoing replacements with that across the board in our HVAC systems is very important. And of course, at Hedda Meadow, making sure that we include the behavioral interventionist. That's extremely important when you're looking, especially now. It's not that it didn't exist, the need before, but it further was exacerbated as kids are returning from a pandemic, and many of whom may not have been in school or have anxiety. these are the areas that we highlighted and want to make best use of those funds. I don't know, so what we want to do is continue to post the new document ESSER 1 and ESSER 2 on the website so that parents can see. I will bring that up in my communication this week. We will continue to collect data and solicit feedback. Remember, our plans will change and can change. Our application is due right now, August 16th, but there will be opportunities to make revisions, and we will post any changes to the website as well. But we really did take into consideration what the feedback was, and we wanted to point out that it's really all there. It's just that if you only look at ESSER 3, and I can understand, because that's all we were tasked to do, was to ask for the feedback for that plan. I really can't respond to what the thinking was there, but I wanted to make sure. There was a question also on the assessments that the Fountas and Pinnell. And again, I just wanted to reiterate what Ann Uberti had said, is that, we're providing evidence-based reading instruction through the use of very systematic and sequenced, direct, and explicit instruction in fluency, vocabulary, and comprehension. And multiple studies have found that this is the best approach to be successful for early literacy instruction. Just so you know, the Fountas and Pinnell those are benchmark assessments. It's only one system. It's only one measure. So there are other measures as well, and they'll be used in conjunction with our other assessments, like our DIBELS and our computer adaptive tests are just several, or two, to evaluate students' reading and comprehension. So together, the results of these assessments can help inform our instructional decisions, track our student progress. That's also very important, as well as to identify strengths and weaknesses that can be addressed through explicit instruction. It also provides information that allows teachers to appropriately choose texts, literacy texts for students for independent reading, instructional reading, and read alouds to ensure that they are exposed to a variety of high interest and complex texts. And that's regardless of reading level. In these ways, the assessment supports what we already know about the science of reading, and garners valuable information for us. So it really helps us determine individuals' processing strategies, fluency, and comprehension. So, and again, that's only one measure. So I wanted to make sure I clarified, because that was one of the questions that did come up. So we really are taking in the feedback and trying to address that, as I'm doing here publicly. We will put as much information up on the website and continue to solicit any other further information from stakeholders. So, Kristen, did you want to add something I might have forgotten? I don't know.
No, just that we'll be submitting. I hope to submit either by Friday this week.
So again, we had clear criteria. Everything that we've asked for should meet those that criteria as we move forward. And certainly the state would come back if there was an issue. But we hit all of the points, I think, that were outlined in the criteria, and I think it makes sense. And one of the other questions had to do with offsetting the budget, and then what happens as you burden the budget when they come off. That happens whenever. Again, you've heard me say this again and again, but that's why you want to focus on things that you either know you only need for the year or two, or those things that can help, provide less of a burden to the budget for 2 years, and then reevaluate whether or not those are needed. But I have to say that those areas, when it comes to mental health or special education, would most likely be something we would look to anyway. So, and we're able to good for us. We're able to find funding for that, especially now as students reenter our classrooms and need the kind of support and attention that we know they will need. And that does fit the criteria. So I wanted to say that publicly and hopefully clarify some of the misconceptions about use of money and what that actually means when it comes to the budget.
Right. Does anybody have any questions or comments? Ran through it all, and I guess I have a question for Tanya, and that is, and it has to do with budgeting, and it comes up every year at budget time. How are we accounting for the grants that are coming in? So I was wondering if you've thought about how we can present that in our budget. So that
yeah, Dr. Cool, so I have been thinking about that a lot. And so I've come up with a couple of ideas, and it's not only just the ESSER grant, but you also have entitlement grants. You have Title I, IDEA, Title II. So we've never had this before in the budget, but I'm thinking about presenting all of the grants and just separating them by title grants, expense offset grants, other federal grants, and the private grants. So, I'm thinking about a separate page, separate section of the budget book, and also to show the FTE and the staff that these grants support. Because that's another area that we don't typically list in the budget. So I kind of want to, highlight that, because we really do receive a lot of grant funding. I'm looking at something right now that we just started putting together. And just this past year alone, and this isn't an exact number, but we've received over $3 million in federal and state grants. And this is all the grants that I just talked about, the entitlement grants, and other expense offsets. And that includes the excess cost grant as well. So yeah, I'm just pulling together some ideas now on how to present this, and we'll talk more about it as we go along.
Good. Yeah, I imagine that might help clear up, the confusion over the Novo grant and what that's paying for, and what the ESSER grants are covering. I think that might help some. It would help some, not just might, it would.
Yeah, definitely provide some clarity. Yeah.
All right. Anybody else have questions or comments? I guess one other question, and I don't know, Ms. Larson or Dr. Rodriguez, if you can talk about why was there such a push for stakeholder input on this? Where did that come from? Because that's not always the case.
In this particular case, that came from the federal government down to the state, correct, Kristen? So that the state put in to place so that when we would request the funding, that there would be a natural connection with the stakeholders so that they would be able to weigh in and have some input as to how those funds would be used in a school system.
Interesting.
I assume it's probably also about the amount of funding. Each ESSER round was substantially more. So this is a fair bit of money going to districts. So they were hoping for more engagement with all the stakeholders involved.
Yeah. Yeah, I know I've heard some of the congressional representatives saying, just be super, I don't know, not careful, but you need to be transparent about how all this money is being spent, because it is a lot of money.
Mm-hmm.
All right. Any other questions? Yeah, Mr. D'Elia.
I just wanted to thank Kristen for coming and sitting through the meeting. And not a lot of people know Kristen or know what she does, but it's a very important role, and she really helps the kids a lot with her work. And I just wanted to say that out loud so that she knows that I appreciate, and I'm sure all the community appreciates all of her work. So thank you, Kristen, for that. And it's very important work that you're doing. And it means a lot to the kids, and you're helping the community.
Thank you
Indeed.
so much.
Yes, yes. Thank you. Yes, thank you for being here and thank you for all you do. Much appreciated.
Okay.
Okay, any other questions or comments before we wrap up?
Motion to adjourn.
Oh, we're okay. We'll close out that discussion and we have a motion to adjourn.
I have a second.
All right, Mr. Cruson seconds. All those in favor? Aye.
Good night, everybody.
Good night. Thank you,
Good night.
everybody, for
All right.
being
Thank you.
here. Much
Thank you.
appreciated.
Thank you.
Bye-bye. Good night.
Night.